we lack logistics. When I say logistics, I mean vehicle. I mean motorbikes, even computers, for us to be able to store data on this COVID has been a challenge. Some of us don't even have offices in our sub-district zones.
That was Yao Akwalate, the national president of Environmental Health Officers Alliance Ghana, speaking to Citi News on the sidelines of a burial of persons who succumbed to COVID-19 at Akwatia and Kede over the weekend. Mr. Latte, who took turns to advise Ghanaians to remain responsible and protect themselves by adhering to all safety protocols after enumerating their challenges and calling on government to resource the environmental health unit in the country, never gave a slight indication about an intended strike action. But in less than a week, the association has laid down their tools. The environmental health unit remains a formidable unit in the country's health sector, backed by a public health law enforcement mandated by Section 14 of the Local Governance Act 2016, Act 936, with an amendment, Act 940, empowered by Executive Instrument 4 of 1976 to discharge their duties pertaining to their job description. From the onset of COVID-19 pandemic and when Ghana recorded its first case, the Environmental Health Unit has given off their best working in collaboration with other relevant agencies in the fight against the pandemic. But according to the association, officers in various districts have been going about their duties in a bizarre manner, as they have been conducting burial for persons who have succumbed to COVID-19 without the needed personal protective equipment, HAS, and other monetary incentives which other health workers have received in the fight against the pandemic. Yao Akwalate, the president of the association, has been throwing more light on the importance of the actions.
We are laying down our tools because from the COVID-19 barriers, because of lack of personal protective equipment and other things that we need for the burial. Some of the personal protective equipment are the Wellington boots, the nose mask, the goggles, the coverall, the aprons, the hand sanitizers, the tissue papers, and the rest, especially the chemicals. We need it as soon as possible from government. Therefore, all those who are burying and have not gotten the needed logistics to do the burial, kindly lay down your tools, because the new variant is so deadly and we don't want it to get out of hand, as most of our members in the eastern region and the Ashanti region had infection. Some of them had the infection all right, but God being so good, they were able to recover. And the insurance that the government of Ghana, through the Ministry of Ghana, Ministry of Health, Ghana Health Service, promised that it will be given, none was given to all the environmental health officers who had these infections.
Mr. Latte, however, issued a word of caution to heads of metropolitan, municipal and district assemblies who would try to victimize their members over the strike action. Until members of the Environmental Health Officers Alliance Ghana call off their strike, relatives of persons who have succumbed to COVID-19 would have to look for other alternatives in assisting them to organize a befitting burial for their lost loved ones. But the question still remains if hospital authorities will release the bodies to relatives without authorization from any environmental health officer.
For Citi News, Neoni Amati Kanaku.